Now I'd like to welcome Representative Terri Sewell of Alabama. Representative Sewell is part of the Ways and Means Subcommittee on Health, and she also co-chairs the new Democratic Coalition Healthcare Task Force. In 2021, her Maternal Vaccination Act passed the House, which sought to increase vaccination rates among pregnant and postpartum individuals. Congresswoman, thanks for joining us.
Thank you so much.
Let me start with that legislation. That passed the House, if I'm not mistaken, looked it up this morning, by voice vote. Had a number of over 50 co-sponsors. Not many things pass by voice vote, and then it just wasn't acted on in the Senate?
Well, what happened was that it became a part of the omnibus bill that was wrapped into Build Back Better. And Build Back Better, as we know, did not come up for a vote on the Senate side. So we look forward to reintroducing the bill in the 118th Congress. And as you said, it passed with a voice vote, unanimous consent. So we're looking to get on the suspension calendar, this bill in this Congress.
And do you think that now with the House flipping, as you know, it passed unanimously, so do you think that's going to get on the House floor at some point?
I do. I do. You know, we on the Ways and Means Committee, through Republican and Democratic administrations, have sought to get bills that do have bipartisan support on, suspension calendars before. So it's my hope that we will get the Maternal Vaccination Act, which I introduced last year, and get it into this 118th Congress. You know, it's so important. Vaccinations save lives. And the Maternal Vaccination Act really came about because I was really could not believe that so many pregnant women were not getting vaccinated. But vaccinations obviously save lives. And so it was an effort to acknowledge also that African-American women die 3 times more likely than white women in childbirth. And this day and age when, advanced medicine and of course, the United States being an industrialized country. So the bill really did get widespread support. It would provide, an opportunity, funding for a public awareness campaign to promote the materials and to make sure that moms and children got vaccinated and to really increase awareness. It's a big trust issue when it comes to vaccinations. And we saw that so clearly during the beginning of the COVID-19 pandemic. I represent the state of Alabama, more particularly Selma, Montgomery, and Birmingham. But I can tell you that in my district, what loomed large was the Tuskegee Project that, occurred back in the 50s and 40s. But the reality is that government was a bad agent when it came, or a bad actor when it came to giving to experimentation on African-American men regarding syphilis. And so that's real. And so getting public awareness about the effectiveness of these vaccinations, especially the ones for adult women who are pregnant and their children, is something that's really, really important.
We have an audience question, and it plays into a couple of issues that you were talking about, certainly identifying them. But this is from Michaela Jackson, Program Director, Prevention Policy, Hepatitis B Foundation. How can we work to ensure more equitable distribution of vaccine funding for all adults, including the uninsured populations?
What a great question. In fact, it's one of the things that I really fight for is equitable distribution of resources and equal access to quality and affordable care on the Ways and Means Committee. And I think one of the ways that we can do that is by being intentional in making sure that public awareness programs and influencers, community influencers, make aware the importance of these vaccinations in uninsured populations as well as in vulnerable communities. And so I think we have to be intentional in our focus on making sure that vaccinations are readily available, especially in low-income, vulnerable communities. And also because I think, these are communicable diseases that really do save lives and would prevent deaths. So I think that I know in the Omnibus Act, we had several bills, especially my bill, that really was about providing an awareness campaign and specifically in those underserved communities and underserved and uninsured populations. And so, it's about providing evidence-based information and resources on the safety and importance of these vaccinations to public health departments and by public health departments as well as healthcare providers. And so I think that being intentional in that, making sure that the resources that are available, funding that's available for these vaccinations get to these vulnerable communities, uninsured communities, and that we also make sure that the folks who are providing that information are the trusted community leaders.
And how do you mentioned trust, and that's important in any relationship. As far as what kind of works in Alabama that you've seen of getting people to trust policymakers and healthcare experts who say, no, this is good for you. It's going to possibly save your life. What works on the ground?
Great question. What we found is that not so much politicians, but it's the pastors, the first ladies of the churches, the healthcare providers, your daycare center providers, when it comes to sort of maternal vaccinations. But, I think it's really finding those folks in the community that have always been a more trusted validator, if you will, so that you're actually getting your information not just from healthcare providers, but you're hearing about that information while you're at church, having health fairs at the church office, at the church rectory has been a really great way that we were able to boost the numbers for COVID-19 vaccinations in my area. We really did try to partner with those folks in the community that people seem to have great influence on average everyday Americans. So definitely the faith-based organizations were really effective influencers for COVID-19, and would be something that I think is important that we make sure that these nonprofits that are actually community-based also receive the resources to get the message out and to do the public awareness about the safety of these vaccinations.
And that's a fascinating answer because, pastors are more trusted and have higher approval ratings than politicians, as well as the media for that matter.
Of course, we like to think of ourselves, I like to think of myself as a public servant, not a politician, but I have to tell you that when I got the shot and it was tweeted out, the first COVID-19 shot, I got a number of folks retweeting it. But when my mother, who was a former librarian at the only public high school in my hometown, oh my God, it shot up exponentially. So it's finding those sort of trusted, leaders, our teachers, our coaches, our, pastors.
We have a new Congress. We've got divided government now, very narrow majority in the House. What is doable on healthcare / vaccine? What do you want Congress to do this year into next on these type of issues, other than passing your bill?
Yeah. Yes, passing my bill for sure. But I also think that we can't underestimate the power of good legislation getting bipartisan support. And I think that my bill is a great example of that. I also carry a bill about multi-cancer screening. There's so many of us that have been affected by cancer that is preventable on the front end if you have screens. And there's so many new technologies that are out there that we want to make sure that the FDA, when they approve them, that we make them available to our seniors, to everyone, especially those in vulnerable communities. And so a good example of sort of bipartisan support, long before COVID-19 hit, I was a part of a bipartisan health task force. It was called the Rural and Underserved Communities Health Task Force within Ways and Means, and it included two Republicans and two Democrats. And the two things that we all agreed on was that we needed better workforce and we needed to encourage that. And the second thing was about telehealth and and being able to make sure that's accessible. So when COVID-19 did hit, we were well on our way, to really getting telehealth to be reimbursed. And so that was a natural after COVID-19, but, and during COVID-19, it was really a lifesaver. So that's one example. I know that we also are all concerned about making sure we have, primary doctors, internists in rural communities and underserved communities where there's often a lack of them. And so finding bipartisan support on bills that relate to, access issues, as well as making sure that we have access to quality, affordable healthcare, not just in terms of prescription drugs, but also in terms of vaccinations and in terms of having enough primary doctors in those areas.
I did want to ask you, I know that tornadoes hit Alabama. How is that cleanup effort going with the assistance of the federal government?
Yeah, thank you so much for asking. Yes, my district was hit horribly by the tornadoes of January 12th, and my beloved hometown of Selma, Alabama, had over 6,000 properties that were damaged. It was widespread. People know of my hometown because of the bridge and the march that John Lewis and others took on Bloody Sunday that really brought about the Voting Rights Act. But it's a town of 19,000, and as every graduating class from high school occurs, less and less people stay in my hometown. So really, I can tell you that no truer word it was said than neighbor helping neighbor when it initially happened. I happened to be able to get to Selma the night of the tornado, and I can tell you that we are working as hard as we can, and definitely benefited from nonprofits and faith-based organizations and neighbors helping neighbors. To get us back up and running. So I thank you so much. And our governor made the request of President Biden, and he issued a disaster declaration within days of it occurring. But it's going to take a long time for those communities to rebuild. And we hope that out of this tragedy comes an opportunity for us to reimagine Selma and those other communities that were affected by the storm, and so that we can really rebuild stronger and better than we were before. So thanks for asking.
Yep, no, neighbors helping neighbors. It's a powerful story, and we've seen it a lot. And good luck with those efforts. And Representative Sewell, thank you so much for joining us today.
Thank you.